Greetings! Today we're breaking down an important topic in brain and hormonal health, prolactinomas. Whether you're a concerned patient, a medical student, or a healthcare professional, this should give you some clear understanding on what they are, how they're diagnosed, and how we manage them. So, prolactinomas are benign tumors of the pituitary gland that produce too much of a hormone called prolactin. This hormone normally helps regulate reproduction and lactation. When produced in excess, it disrupts the hormonal balance. They are the most common type of pituitary tumor, especially in women aged between 25 to 44 years. In men, they are less common and often larger when discovered. So how do they present? Female patients may experience missed periods, infertility, or milky nipple discharge not related to breastfeeding. Men might experience erectile dysfunction, loss of libido, and even breast enlargement. What happens in both of the sexes? They could experience headaches, especially behind the eyes, visual changes, or other signs of hormonal imbalance. But remember, not having obvious symptoms doesn't rule it out. How do we diagnose it? This involves blood tests, namely a full hormonal profile, especially to check prolactin levels and to rule out other causes, such as medications, notably antipsychotics, stress itself, hypothyroidism, or pregnancy itself. An MRI of the brain is done to visualize the pituitary gland. A key clue: if prolactin levels are high and there is a visible tumor, it's likely to be a prolactinoma. If the tumor is large but prolactin is only slightly elevated, it may be due to something called the hook effect, or it might not be a prolactinoma at all. So how do we treat it? The first line is usually medical. Dopamine agonists like Cabergoline or bromocriptine lower prolactin levels and shrink the tumor. They are generally safe, but may cause nausea, dizziness, and mood changes in some cases. In rare cases, surgery may be required, especially if the tumor is resistant or causes visual loss, or if the patient cannot tolerate medication. For women wanting to get pregnant, careful planning is needed, and in children, men, treatment must be personalized. What are special considerations? Bone health can be affected by long-standing high prolactin, so bone scans are sometimes needed. Follow-up MRIs are based on tumor size and treatment response. Some patients can even stop medication after long-term control under supervision. So, let's conclude. Prolactinomas are common, usually treatable, and often respond well to medication. But timely diagnosis is crucial. If you or someone you know has symptoms, especially changes in the menstrual cycle, libido, or unexplained headaches, speak to a doctor. To medical students and residents out there, this is a perfect example of how endocrinology, neurosurgery, and radiology come together in real-world practice. Thank you for joining us. Stay curious, stay healthy, and have a blessed day.